你有咁大個肉瘤，你唔割點得？個肉瘤咁塞住晒喺度，咁成日發炎，整整下你個腎都壞埋啦！你咁成日有啲發炎唔得㗎，真係累死你㗎！割症咁簡單，即係我哋希望咧，你5年後咧，你學到一個態度，就係咧，知道你只係識得少少嘢嚇，僅可以俾你起手醫下病人，咁跟住咧，你個以後一生一世你都係一路繼續學。
Mr. Pro-Chancellor, I present candidates for the degrees of Bachelor of Medicine and Bachelor of Surgery.
Professor Ma is Dean of Hong Kong University's Faculty of Medicine. In her 30 years with the faculty, she's trained thousands of doctors. The professor is well known for her stringent requirements, and her very presence in the wards keeps every doctor on his toes.
咁梗係有啲緊張啦，一定嘅呢啲。你俾人問喎，有機會俾人鬧喎。
Are you surprised that she did not respond to the medical management? Are you surprised?
Not really, because she has quite an extensive disease.
I don't think that's the answer. Galai, why didn't she respond to all these dinosaur, GnRH? What sort of disease she got?
She got severe endometriosis.
Is that the disease she got? If that is the disease she got, then she should have responded to all these medication.
And also from the history, she had rice pile soaping, so she also had PID as well.
I don't think it's the PID that's giving her all this pain. Let's say some uterus is 10 weeks high. What should be the uterine cavity length?
12 to 14 centimeters.
Nonsense. Then you perforate every uterus. If it's 10 weeks, she said it's 14 centimeter. So you perforate every uterus. How can you be doing evacuation without knowing all this? Oh, wow, your patient has been extremely lucky. How long has she has this pancytopenia? You expect everybody on cisplatinum to have some pancytopenia, isn't it? When do you expect it to occur?
It was just after chemo.
How long when if you give somebody cisplatinum, when do you expect that the white count would fall?
No, I'm not sure.
But then don't work in this ward then, if you're not sure. Go home. How can you treat patients when you don't know the action of drug? Just go home. Susan,
This patient is another...
try to get a fairly quick CT scan.
Professor Ma has been teaching Dr. Chan for 3 years, and the young doctor has long grown accustomed to her mentor's temperament.
講真，邊一個人冇犯過錯啊？個個都有犯過錯㗎啦。
唔怕鬧，
唔怕，鬧咪鬧咯。喺屋企都俾阿媽鬧慣㗎啦，唔通你又鬧阿媽咩？
即係嚴肅的話，佢哋咧係有一定嘅作用㗎。好多時如果我諗翻我細個嗰陣時間咧，我記得嘅嘢咧都係好多時咧係嗰個即係我個高級嘅先生或者咩好嬲咁樣話我，咁我倒轉個印象係好深。咁所以雖然咧即係有時或者我事實上唔係嬲得咁緊要嘅，不過但係咧你點都要作起個狀嚟，即係令到佢哋即係記得呢個好緊要嘅。如果你咧樣樣咧都係好細聲咁勸告咧，好多時咧啲年青嘅人咧佢就未必記得㗎啦。
都唔會話太特別話難過嘅，主要就係諗下，譬如話俾佢鬧完之後咧，咁你諗下你嗰個治療方面就係點樣改進咯，即係點樣即係下一次做好啲咯。
In her dual role as Dean of the Faculty of Medicine and Head of the Department of Obstetrics and Gynecology, Professor Ma finds no shortage of administrative chores. General teaching assignments go to her assistants, but her concern is evident for final year students. She invariably gives the first lecture.
就係要解俾嗰啲學生知，佢啲應該點樣讀書咧，好怕人讀死書㗎。每個病人都唔同啦，啲病情啊樣樣都唔同。So instead of reading the same chapter 3 times, my suggestion is to read 3 different chapters on the same disease. You understand what I'm trying to say, so that you get the different views and so on.
Medicine must be practiced with ethics.
Who do not go and argue with their patients or scold their patients. So if you do not follow this sort of etiquette in your behavior, you will be disciplined. And you will not become a doctor, I tell you. So be careful what you said and be always polite. 你太瘦啊！你要食多啲嘢先得啊！你咁瘦唔得㗎，唔會好㗎，又青雞咁面。You know these are long-term treatment. When you treat the patient, you have to be very careful about nutrition. If her nutrition is no good, then she will not be able to last the complete course. Find out what she's eating at home, whether she's eating properly, give her some advice, sensible advice. Well, you are a housewife, you should know. And then also suggest that she drink some complement. 你又唔食得夠肉，喂，食咗嘔咁你翻去唔嘔㗎？翻院先咯，有㗎。咁我知啊，但係你翻去要飲多啲牛肉茶啊，嗰啲咁嘢連牛肉都要食埋咁得㗎喎。你唔食得夠嘢啊，你瘦成咁。And then see if she got money. If she hasn't got money, try to get her some.
Dr. Ng is an intern in the Department of Obstetrics and Gynecology. In a few more months, he'll be looking for work. Many graduates are worried that the hospital authority won't employ them. After a speech by Professor Ma at the graduation dinner, their spirits took a turn for the worse.
當時咧，即係差唔多係6月尾嘅時候咧，咁就當時咧有好多實習醫生咧就過咗佢哋嘅訓練之後就揾唔到嘢做，咁我哋大家都好驚啦。但係當時咧佢就即係叫我哋你大家反省下，即係你對病人唔好啊，有啲又好懶啊，咁即係佢覺得有啲唔係一定要揾俾份工你做啊咁樣咯。
我就想或者借佢哋嗰次食飯咧嚟到話俾大家知。世界咧，即係唔係咁簡單，唔係話你一畢咗業咧就可以坐喺度就諗住有得有工打有入息根本咧喺全世界咧都係普通嘅一個新畢業生咧都係好麻煩，即係都係有困難嘅，都係要去揾工嘅。香港嘅年青人咧就似乎咧呢近年來咧覺得係人哋欠咗佢㗎，社會欠咗佢㗎已經供咗佢咁多年讀書啦，就而家仲要欠咗佢份工添咁，我覺得呢個態度係唔對嘅。咁我就希望佢哋要改呢個態度。咁事實上咧係即係當然啦，報紙報道樣樣咧，好似話呢次唔夠位收晒我哋嘅畢業生係一個即係好唔好嘅事咁樣啦。但係事實上咧係有一個好好嘅影響㗎，就係我哋發現咧依次而家我哋做緊啲實習醫生咧，或者甚至乎出年嗰啲畢業醫生咧，我諗佢哋嘅工作態度係會有進步嘅。
唔係喺出邊着，
你要入嚟呢度着先得。
喺杯嗰度㗎，因為個鞋套乾淨㗎，你唔想着完個鞋套踩翻去啲污糟嘅地方。
Several months ago, Hong Kong U's Faculty of Medicine opened its doors to the public for the first time. Professor Ma hopes that aspiring medical students will set themselves in the proper frame of mind.
我哋希望咧，佢自己申請嚟讀醫科嘅自己嘅學生係明白佢哋自己係咪真係想做醫生。當然係有啲畢咗業嘅醫生，佢根本係唔中意做醫生㗎啦。呢個即係邊度都有㗎啦。咁即係以前咧，即係我哋亦都覺得好似即係冇注意一點。咁我哋而家嚟講咧，就發現即係好似喺世界方面咧，即係在呢一點咧就已經發展得好好多。我哋香港係落後。做醫生咧，真係唔係需要一個人或者聰明到絕頂嘅，但係咧又需要一個人咧好有愛心同埋要好勤力。過往咧，我哋係太過注重嗰個即係嘅成績啦，喺成績方面覺得太緊要。我哋而家咧即係有少少覺得咧，就我哋師爺咧，或者我哋以往揀學生嘅方法唔係咁嘅。
In recent years, there's been a decline in the exam results of students admitted to Hong Kong U's Faculty of Medicine. Before 1985, only A students made it. Now most of them are B students.
我哋普通平均嚟講都係 B， 收嘅都係 B。1985年以前嗰啲咧就都係 A 嘅，最好嗰啲都仲係申請醫學院嘅，因為我哋降低咗佢入學嘅資格，唔知會唔會就係令到嗰啲真係好想做醫生，佢就算成績唔係咁好，佢都敢膽嚟申請，我哋又收咗。
Professor Ma thinks that academically, students entering medical school today can handle their coursework. What's lacking is the command of English.
The pregnant woman.
There's some procedure of the abortion will also give some risk to the pregnant woman. We weigh those this risk, and if the risk of termination is smaller, so we done the termination.
Luckily, Hangzhou job is in Chinese. Otherwise, it will be shown to the Hong Kong public that our student cannot speak English.接收梗係好啦，係咪係喜事喎？咁多數我接嗰啲都係瑪麗醫院自己醫生好熟嘅，即係我又尤其是如果佢第一個又係我執開啊，咁我又冇乜所謂啦。即係我出邊嘅病人係接生嘅咧，都好少㗎啦。我哋部門有啲高級嘅先生專門做高危產科㗎嚇，咁唔需要我睇啦。
All medic 71, please. Move forward for the photo taking.
Professor Ma graduated in 1958 and became department head in 1972. While many of her former colleagues eventually went into private practice, she chose to stay with the faculty.
我諗主要就係研究同埋教學咯，即係呢兩樣係你譬如出咗去做私家嘅婦產科醫生，你就冇呢兩個，即係呢兩方面你就冇得做啦。你如果你自己唔覺咧，你自己整到個腎又壞啊，咁樣就冇意思啦。你而家先48歲，咁你諗住點啫？個肉瘤唔會自己飛出嚟㗎嘛，又唔會無端端細㗎，只有大嘅啫。你大佢就大啦，係咪啫？快啲聽林醫生話啦，唔好多事實啦，好嘛？好啊。嚇？好啊，唔該你啊！一陣你又轉掛啦嚇，我哋一行過即刻話走。OK 㗎 ，OK。咁我主要咧就係要提醒佢哋，就係每一次佢哋即係醫個病人嘅時間，佢要喺個病人方面嚟到着想，因為腫瘤病人咧，尤其是藥物方面有好多副作用，係咪會啲藥物嘅副作用仲令得佢辛苦過個病咧？做咩啊？冇表情啊，唔舒服，頂住係嘛？咁而家打咗嗰啲針舒唔舒服啲啊？嗰個暈嚇，有少少暈啊，不過你冇辦法㗎啦，嗰啲藥係會有啲咁多唔。玩地瞓多啲咁樣啦，
啲癌細胞擴散晒，
擴散咗啦嚇，不過不嬲都擴散㗎啦。嗰啲藥冇咩大用啊嘛，真整得你唔舒服，不如唔好啦咁樣咯。我哋就即係我哋而家用第啲藥咯，即係嚇。你慢慢等我哋教好啲藥會舒服啲嘅。好冇？做瘤腫醫生咧，就應該用咁嘅態度嚟睇。即係唔應該話咧個病人醫唔好咧，你就係一個失敗。但係你醫唔好，你頂到佢係冇痛苦，咁都係一個成功嚟嘅。
Over the past 4 years, there's been a steady drain on the number of clinical lecturers. Of 140, over 30 have left. Hong Kong U's Faculty of Medicine has always believed that local experts who are familiar with medical cases in Hong Kong make more suitable lecturers. This is why it has always hoped to retain outstanding graduates on the teaching staff. But in recent years, many doctors were reluctant to stay. Even more have chosen to leave.
裏邊嗰啲因素好多係唔到我，即係我能力上係我自己即係唔可以辦得到嘅。即係例如，譬如好似香港嘅將來啊，即係香港社會將來嘅轉變啊，令到即係普通一啲年青嘅醫生即係有啲咁多顧慮啦，或者甚至乎佢哋即係移民啊咁樣，呢啲我做院長嘅，我相信咧就唔係可以即係我個人嚟講辦得到嘅。咁再加以咧，即係近來咧，即係醫局成立咧之後咧，香港大學嘅即係嘅呢個臨床嘅教職員嘅待遇咧，同醫局嘅待遇咧係有啲唔同。咁咧，我哋一般有啲年青嘅講師咧，佢哋就認為咧，我哋而家香港大學嘅待遇咧係比唔上呢個醫局嘅醫生啊。呢幾年咧，即係臨床嗰啲部門咧，我哋唔可以話100%有晒教職員啦，只可以係有70%到，即係比較上教職員係難揾人，同埋即係個流失量亦都高嘅。我部門醫生都唔係咁多，冇乜去移民啦。咁我主要咧就係講佢哋知，就係咧，如果佢哋係即係叻，同埋咧即係如果佢哋係事業上咧係有成就咧。就老實講，如果佢去到邊度咧，都唔使閉翳㗎。到時咧，如果佢真係唔中意喺將來嘅香港做嘢咧，佢隨時都可以請，咁唔使而家早啲請定先啦。
Professor Ma regards 1997 with an air of optimism. Apart from persuading doctors not to rush overseas, she strengthened contacts with the medical profession in China.
在嗰個中國唔開放嘅年份，我哋冇辦法咯。咁所以一開放之後，個個部門都係有同中國有聯繫嘅。
4 years ago, Professor Ma's department started working with Chinese hospitals to collect plasma from pregnant women in Beijing, Shanghai, Kunming and Guangzhou. The objective was to study the relationship between diet and diabetes among pregnant women.
我哋咧就喺中國4個城市同埋香港咧，就為總共1000個孕婦咧，就係抽咗呢個血嘅樣本。咁係用專人咧運到廣州，然後再由我哋嘅同事去廣州攞落嚟。咁我哋點解要運到將咁辛苦將嗰啲血漿運到嚟香港做化驗咧？就係我哋希望嗰個化驗方法係比較統一，同埋得出嚟嘅結果咧係比較準確。我哋初嗰陣時做就話諗住咧，佢哋根本喺嗰度啲化驗咧係好少，即係好簡單。咁我哋以為每一個中心即係參與個研究都可以自己做到，點知我哋又發現佢做唔到，結果又要搬晒翻嚟香港做。咁再加上咧，我啱啱上起嗰陣時咧，就係1989年64嗰陣時嘅，咁變咗又阻咗個時間，嗰度又阻咗1年。本來係我哋預備1年嘅功夫，做出3年。我覺得係值得嘅。第一個結果係應該係有啦。第二咧就我諗佢哋經過呢個咁嘅研究咧，佢哋都明白咗好多，即係有咗經驗，將來再做第2次或者就易好多啦。
The Faculty of Medicine is also assisting with the training of doctors in China.
Would you please tell me the difference between the post and a gift?
Dr. Yao comes from Xi'an, is spending 6 months in the department to learn the techniques of artificial insemination.
因为这个国内呢有很多的这个不孕症的病人呢是非常多的，就是需要一种比较好的方法、好的技术来治疗。所以呢，目前呢在国内这方面呢也是刚开展。国内呢也有几家医院也开展，学习机会也有的，但是呢这也需要申请，所以呢也需要有机会，也有一定的困难。
Dr. Wu, who's from Shanghai, has received permission from the Medical Council to practice for a year with professors in the Department of Pediatrics. Dr. Wu has discovered that some babies in Hong Kong and China have aortas of different sizes, despite the fact they're all Chinese.
醫生落到嚟咧就發現到咧就香港中國人咧就有呢個主動脈狹窄呢個情況咧機會就多好多。佢喺國內咧就好少見到呢個情況，咁佢就將呢個資料咧就話俾我哋聽啦。咁就因此咧就即係令到我哋咧就 想作一個進一步嘅研究，因為大家都係中國人，點解會香港咁多初生嬰兒有呢個主動脈狹窄，而喺國內就咁少機會見到咧？咁我覺得就有一定嘅需要作進一步嘅探討。
咁個研究嘅結果，我哋當然得益啦嚇。再加以咧，譬如佢做臨床，咁佢有參與我哋臨床嘅工作噶嘛，咁亦得益咯。好多方面得益嘅，咁再加以咧我哋變咗即係同佢哋熟絡咗啦。咁將來譬如我哋繼續一齊合作研究，咁亦都好簡單。
Professor Ma says that when Hong Kong returns to China in 1997, there will be a need for suitable adjustments to the curriculum of the Faculty of Medicine.
我哋將來咧應該或者同中國大學嘅醫學院咧係比較上課程啊方面配合少少。我哋教學生嘅科目啊樣樣裏邊着重咩咧就會有啲轉變。今年咧即係1993年就應該我哋總結。咁所以暫時我就唔知道邊方面要改，因為我絕對冇意思降低我哋嘅水準去遷就中國。97之後，佢啲畢業生落嚟仲要考個牌照試啦。咁而家我哋已經有㗎啦，嗰個非英聯邦嗰個試，將來會擴大到我哋本地醫學院嘅學生都係要考嗰個試。所有喺香港行醫嘅醫生都係一樣水準。香港大學長久嘅計劃咧，要係同中國有好多聯繫嘅咁樣，即係令到咧我哋嘅畢業生咧係適應在將來香港嘅社會工作，在將來中國嘅社會工作咁樣，我哋係應該係令到佢喺中國任何一度行醫，佢一樣係咁好。
本來靚仔又咁㗎，你咪咁㗎咋？係啦，咁似樣啊！你而家快影翻個靚仔相去啦。係咁樣㗎。哇！呢班幾多個女仔啊？咁多嘅？